Hello students. Do you think exam is always coming with lot of tensions and worries? Not anymore. Because we are here to make you ready and prepare for your upcoming GNM exams. I am here today with the most important and enlisted question which will be definitely come in your exams. So further any delay, let's just jump into the video. So, our today's subject is community health nursing. We know that community health nursing is little bit elaborated, but I have break it down into different parts and make it very easy so you will guys able to understand. Not only that, but you will able to remember all the points. Okay, so if you able to understand and try to at least remember the points, you will able to answer every questions. So just let's see what are the topics. In community health nursing 2, we will be discussing today national health programs of India. It's a quite a big chapter, I know. Okay, but let's just make it easy. Okay, so national health programs in India. So what are those? We know in India, okay, there are a lot of health problems, isn't it? So we have divided in communicable and non-communicable disease. So as per the different kind of disease, there to control that particular disease, there will be different kind of health program which will be held by the government. Okay, so the national programs are initiative by the government aimed at improving overall health of the population, reducing the disease burden, the death rates, addressing specific public health challenges. Okay, and also these programs are aligned with public health priorities also and are critically community health nursing for planning and implementing an intervention. Okay, so here what we are doing in the national health programs, we are planning for preventing a particular type of disease, we are addressing what are the most vulnerable people, okay, and we are treating, and for that if it should not be spread, that also we are taking care of. So that is the national health programs in India. So in the national health programs in India, what are the objectives, main objectives? So it include control and eliminate the communicable and non-communicable disease as much as possible. Then promoting mental health and child health, which is very important nowadays, and improve nutrition and sanitation standard to further not to communicate or not to spread the disease. Okay, then ensure an accessible affordable healthcare which will be accessible to everyone, okay, every general public. Then the promote the awareness about healthy lifestyle, to maintain a proper healthy diet, to maintain good hygiene, and also these are the main objectives of the national health programs. So next we will see what are the programs that are enlisted, okay, the main programs that have been enlisted in the national health program. So we have reproductive, maternal, newborn, child, and also adolescents health care programs. Then we have national health mission, then universal immunization program, national tuberculosis elimination program, national vector-borne disease control program, national programs for prevention and control cancer, diabetes, cardiovascular disease, and stroke, which are mostly non-communicable disease. Then natural AIDS control program, Janani Suraksha Yojana, Ayushman Bharat Yojana, then integrated child development service, and also national mental health program. So these are the main types of national health programs are present in India. So next we will discuss the most important topic in the national health program. Okay, so as we know, tuberculosis is a very harmful disease which will take a lot of time to be cured. Okay, so it's a communicable disease. So to achieve the tuberculosis elimination by 2025 through the universal access to high quality TB care. So by this we are giving the high quality tuberculosis care to the patients who are already affected. Also we are trying to eliminate all the tuberculosis cases in the end of 2025. So what are the key features of this program? So in this, what we are doing, we are implementing the DOTS, direct observed treatment short course. Okay, so we are giving the DOTS treatment strategy. Okay, and also the free diagnosis and treatment services for all the TB cases, okay, TB patient. Then active case finding in high risk population, okay, especially in the high populated area. Why? Because in that populated area there are greater chance to spreading of the disease. Okay, so active cases which I'll be finding in the high risk populations. And then use of gene, then expert for rapid and acute TB diagnosis. Okay, so these are the main key features of this program. Now, what are the strategies this program have been taken? So, the strategies include early detection of tuberculosis cases, including drug-resistant tuberculosis. Okay, also in some tuberculosis, what happened? There will be continuously, because of taking drugs or because of that particular bacteria. Okay, particular tuberculosis bacteria, what will happen? They will be resistant of that particular treated drug. Okay, so no cure will be occur. So in that cases also early detection should be needed, so that the patient will be cured as soon as possible. So that early detection of tuberculosis cases. Then ensuring the treatment adherence through the DOTS, as well as the strengthening health system and monitor the tuberculosis cases effectively, community engagement and awareness campaigns. Okay, most important strategies of the national tuberculosis program. Next we have the national leprosy eradication program, which is eliminating the leprosy as a public health problem and reducing the prevalence rate to less than one case per 10,000 population. Okay, so what we are doing is, in the public health problem, we are reducing at least 1% of the 10,000 people. Okay, and as a key feature in the national leprosy eradication program, what are the key features they have been maintaining? First one is early detection through the active case finding. So we have to find where the patient are being like active cases are there of leprosy. Okay, and by that we can find like wherever it's spreading, and we can prevent the spreading. Next is free multi-drug therapy to all the patient of leprosy, then disability prevention and rehabilitation service to all the general public. Then awareness campaign to reduce the stigma associated with leprosy. Some people are there, or there is a taboo in our society that we should not touch leprosy people with leprosy condition, and we should not share anything with them. Okay, so some precaution we should take, but we should not simply, like, we should not avoid that kind of people. Okay, with this condition. Okay, we should not give any kind of disrespect to them. Okay, so this kind of key features are present in the national leprosy eradication program. National AIDS control program. So as we know, because of the sexual transmission or because of the intercourse and all, okay, if the body fluid, or mostly for the sexual contact only, but other than that also, if any kind of body fluid, like if someone have come into the contact with the body fluid of the AIDS, okay, or HIV patient, HIV AIDS patient, then there is a 99% chance to get the AIDS. Okay, so this program is actually done to prevent the spread of HIV AIDS and provide care, support and treatment to the infected people. Okay, so what are the key features? So there should be, first we should spread the awareness in the generation through the IEC, okay, information, education and communication. Then we have to give the free antiretroviral therapy to the patient or to the persons who are suspecting to get the HIV AIDS infection, or who already have get the infection, especially in some cases like mother have already affected with the HIV, and she is conceiving a baby. In that cases and all, we have to give the antiretroviral therapy. Then condom promotion and blood safety programs, okay, like the using of protection, okay, physical protection while sexual intercourse and all, to avoid the body fluid contact. Also the blood safety programs, like we should not we have to encourage the people, especially medical staff, not to use the same needle which they are using for one patient to another patient, or they should maintain the sanitization, this kind of thing. Okay, also there will be targeted intervention for high risk groups such as sex workers and intravenous drug users. Okay, so these are the main key features of National AIDS Control Program. So in this session, we discuss the most important ones. Now we will move to the demography. So what is mean of demography? So as we know, demography is the statistical study of human population. Also, it will focus on their size, structure, distribution, changes over the time, due births, deaths, migration and aging. So in a particular area, what is the population, how the distribution is, okay, how is the distribution of population, then what is the structure of that, okay, what is the economical system, then what are the birth, death rates, okay, migration rates. This all things we will be calculating under the demography. So that is the concept of demography. Now what are the trends that are present in world and India? The global trends in the demography is declining the birth and death rates due to advancement of the healthcare and education system. So both the birth rates and death rates are changing because of the healthcare and education system development. Then increasing the life expectancy, okay, like previously if we see, just because of dengue or just because of diarrhea, so people were simply dying like before 100 years and all. But nowadays what happening, because of the advanced medical treatment and healthcare system, the rate of death is decreasing. Okay, so large portions of young population, so large numbers of people life expectancy is increasing. Okay, and aging the population in many countries. So these are the global trends. But India, what's happening here, the high population growth is there, through the fertility rate is declining. Okay, also the large proportion of young population with a growing aging population. Also urbanization and migration influencing population of distribution, like from village all the peoples are trying to go into the cities for job opportunities, okay, for a developed lifestyle, this kind of thing. Okay, so these are the main trends of demography in the world and India. So next is family welfare. So to know family welfare, we have to know what is mean by family planning. As we know, day by day the population is increasing in India, we should know about the family planning. How much kid should we take, okay, in family, like after marriage, okay, there should be a planning of giving birth to kids, okay, or babies, and there should be a minimum gap of 3 years in between two kids. Okay, so that is the family planning. So now what is family welfare? So family welfare focuses on improving the health and well-being of the families by addressing the reproductive health, then child health and the population stabilization. So not only we are increasing the reproductive health, like the fertility rate of the females, okay, but also we are protecting the childs, maintaining their health, as well as we are controlling the population by giving the awareness regarding the population and the family planning methods. Okay, so the family planning methods include different, like there are a lot of methods by which people can do the family planning. So first is the natural method. So mainly in family planning, what we are doing is we are controlling the population. Okay, so first in the natural method, the rhythm method. Okay, then rhythm method in the sense like assessing the what is the menstrual period or ovulating period by calculating all these days and all. Okay, so there will be a particular rhythmic sexual intercourse. Okay, so that is the natural method. Okay, rhythm method. Then we have withdrawal method and lactational amenorrhea. Then in the surgical method, tubectomy and vasectomy, which is the more sterilized one. Okay, female sterilization and male sterilization. Then in hormonal method, like oral contraceptive pills or injectable contraceptives, and especially implants like copper T and all. Then emergency contraception such as pills, 21 days pills and all. Then devices for postcoital contraception. Then intrauterine devices such as copper T. Then hormone releasing IUDs we can use, and other than that barrier methods such as condoms, diaphragm and cervical caps. So these are the main family planning method. Okay, so I know you guys already know this kind of thing. I am just reminding you, so in case you are avoiding this or you are just being left from this topics, you'll able to remember if you see this video. Okay, next we will move on to the National Family Welfare Program. So it is launched in 1952. It focuses on population stabilization through the reproductive health, family planning and maternal child health services. Okay, so it in the 1952 it have been launched, and it was dealing with reproductive health, family health, whatever is there. Okay, so what are the components of this family welfare program? So in that, first one is family planning service, which is very important to control the population. Then maternal and child health care, then reproductive health. Okay, and awareness regarding the reproductive health, how the family planning method should be used and all. Then incentive. Okay, so these are the components of National Family Welfare Program. Next is objectives. In objectives, it include control of population growth, which is the main purpose. Then promote reproductive health and the family planning, reduce the maternal, infant and child mortality while conceiving or because after conceiving or delivering the baby. Okay, then ensure the healthy birth spacing. Okay, as I told, 3 years in between two childs. Okay, 3 years gap should be there. Then advocate of small family norms. Okay, like rather than making a big family, okay, or a joint family, small family norms should be started. Like if a husband wife is there, there should be 2 child or 1 child, like that. Small family norms are increasing. Next we have is family planning counseling. Now it is a process where we are giving, okay, or the medical who are well trained in this kind of thing, okay, are giving suggestions and giving a counseling to the expected couple that how to plan their family. Okay, what are the method they should use, okay, how many children they should have, or any kind of disease and all they have in inside their body or not. So this kind of thing is going under the family planning counseling. So it include educate the couples about the importance and benefits of the family planning, then provide the information on available contraceptive methods, then address the myths, fears and different kind of taboos and misconception regarding the birth, okay, giving the birth of the baby. Then offer personalized advice based on the couple health preference and the cultural beliefs. Okay, so these are the main components. So as a nurse, what are the roles we have in the family planning program? First one is education and awareness. In that we have to inform the communities about the benefits of the family planning. And then is counseling to assess the couple and choosing the most suitable contraceptive method. Then service delivery such as administer the contraceptive pills, then injectable pills and IUDs. Then follow-up care such as ensure the compliance with chosen family planning method. And lastly, doing advocacy to advocate the reproductive rights and or access to services. Okay, so this is the main family planning counseling. Next, we have the key strategies of this family planning program. The key strategies include it will integrate with health services, promote the male involvement, okay, which was not that much in the previous times. Then community distribution of the contraceptive methods. And lastly, the role of nurse. First one is educate the communities on the family planning. We have to educate the community, okay, and we have to inform like what are the family planning methods, what are the benefits, what should we use. Okay, we have to give a little advocacy, okay, educate and advocate the people. Then provide the counseling and contraceptive services to the other peoples as well. Then assist with sterilization procedure, different kind of sterilization procedure like male sterilization or female sterilization, okay, tubectomy or vasectomy. Okay, and lastly, to ensure the follow up, address and complications. Okay, so this is all about the family welfare program. So all I have discussed, try to remember the most national health program, mainly the most important one only I have discussed, like HIV, AIDS, then tuberculosis and all. Others are also important, but that are less important. Okay, if you are reading that also, you will able to remember. Okay, so with this session, so with this all topic, I am ending this session here. Be prepared for your exam. Best of wishes for you guys. Thank you. Bye.